या हाय प्रणाम स्वामी जी। मुझे पूछना था मेरी मॉम को ना, माय मॉम इज हैविंग पेन फ्रॉम ऑलमोस्ट लाइक 20 years बिफोर बैक, एंड शी इज हैविंग सीवियर पेन इन द हैंड एंड लेग, like even though we keep on, like she has to hold her hand for the entire day, but we have shown
So
to many doctor, none of them are able to cure it, and they are not able to tell the cause also.
I'll tell you. I'll tell you. See, it is very simple to understand. First of all, you need to understand pain. आपको पेन समझना है पहले. You need to understand pain.
Okay.
पेन इज सम काइंड ऑफ अ ब्लॉक. एक रुकावट को पेन कहते हैं. कहीं से कोई चीज
Okay.
जा नहीं पा रही. If there is a block and things are not able to pass from one place to another, wherever there is a block, there will be a pain. Now,
Okay.
तो कोई भी चीज एक जगह से दूसरी जगह जाती कैसे है इन द बॉडी? इट ऑलवेज गोज इन प्रेशर ग्रेडियंट. प्रेशर ज्यादा होगा कम होगा तो एक जगह से दूसरी जगह मूव कर जाएगा.
Okay.
प्रेशर अगर बॉडी में बनाते हैं तो पेन कम हो जाएगा. इसलिए कुंभक करने से विल सी आफ्टर डूइंग कुंभक द पेन फैक्टर्स ऑफ बॉडी रिड्यूस ड्रास्टिकली. तो कुंभक अगर पेन पेन आपको रिड्यूस करना है, इफ यू वांट टू रिड्यूस द पेन, यू विल हैव टू करेक्ट the movement part of the body inside the body. Everything should be moving inside the body, and that's what कुंभक does. कुंभक की वजह से मूवमेंट शुरू हो जाते हैं तो पेन फैक्टर्स बहुत कम हो जाते हैं. पहली बात तो ये. दूसरी बात, टॉलरेंस, पेन का टॉलरेंस भी बढ़ जाता है. If the tolerance to pain also increases, the body becomes comfortable. The third thing is, pain is not always physical. It is often more psychological. So if you are doing kumbhak, you'll see the mind factor of your body, the psyche of this body, which is associated with the physical body. The mind and the quality of the mind improves. You can come
Okay.
out of psychological pain, mental disorder by doing kumbhak. There is no other way.
Okay.
तो पेन
Thank
के लिए
you.
तो मैं बताऊंगा कि ये करने से पेन तो कम हो जाएगा बॉडी में. We have seen many people coming out of varicose vein by doing kumbhak. So varicose vein can easily be cured. Now 78 is an age which is on a higher side. The recovery strength of the body has also gone down. So even surgery is risky. Let me tell you, even surgery may not be that suitable in this age. Now, the second thing that I want to talk about is many people didn't require knee replacement when they have done kumbhak. So there are many people whose knees have become fine and they are able to walk properly by doing kumbhak. So it can be avoided. The second thing is, even if somebody goes for knee surgery, the rehabilitation, it is not a guarantee that you'll be able to walk fine. Not everybody. So the rehabilitation is kumbhak. If you do the rehabilitation, chances that the knee surgery is actually suitable and the body is able to do proper walking after the surgery, it can be ensured by doing kumbhak. So it is always good that somebody does kumbhak. One, you may not have to go. You can avoid knee surgery. May not have to go for knee surgery. You may avoid knee surgery also. Even if you go for knee surgery, the rehabilitation is quicker and faster. The recovery is quicker and faster. So in both ways, doing kumbhak is something which has to be a must.